With you.
As one of the non-100 most powerful women in this room here, we have long in our conversations on health care talked about the outrage of the uncovered. We've talked about the expense that comes with the overexpense, the overpayment, the non-effective use of dollars. But I don't know that we've talked a lot about the policy implications and the economic implications to the country of that overspending, of that non-return, and I'd like to do that briefly here. What we don't pay attention to enough in this country as we talk about health care within the health care silo is the important linkage that it has to job creation and global competitiveness in this country. What is taking place today around the world is that there is a sufficient base of college graduates, a sufficient base of workers emerging in many, many countries who can challenge us effectively for where jobs should be placed. And for a long time, wage differential was one of the driving factors as to where companies chose to place labor. I will tell you that for college-educated workers around the world, the wage gaps between Europe and North America and Asia and other developing economies are rapidly declining. In fact, in some countries it's now become negligible. What has been growing over the last few years, and nobody is talking about it, is the differential cost of benefits between the industrialized countries and the non-industrialized countries. In particular, the United States faces a growing disadvantage in social cost, and that is primarily being driven by the cost of our health care. So what we have is a situation where productivity has been offsetting gains, has been offsetting wage gaps, and that is being offset by dramatically rising costs inside health care. If we wish to see job loss in this country be stopped, if we wish to see job creation return, we have to address the fact that we've let the cost of health care get to be so out of hand that it's now threatening competitiveness of American industry and making it easier to justify the movement or creation of jobs in other places. Secondly, we have confined our discussion of health care to traditional forms of employment. We've not recognized that, again, around the world, individuals working in non-traditional ways, and in this country we would call those workers independent contractors, temporary employees, consultants, 1 to 2 person professional business offices, freelancers, on and on, but individuals who choose to work in a way that our paternalistic society doesn't recognize as traditional, normal ways to work. That represents today, conservatively, I think between 20 to 25% of the American workforce. It runs that percentage, by the way, in Europe and Asia. It is from that group that you tend to have most new business startups occur. It is from that group that you see the intellectual foment that tends to generate lots of new ideas. It's from that group that you would see new industries like Google and so on emerge. It is that group that, again, we're losing competitively here in the United States, because only in the United States of the industrialized countries of the world do we force somebody to make a choice. Do they engage in that most productive form of labor to creation of new enterprise and maybe have their family run the risk of having to go 1 to 2 to 3 years without health care coverage, or do they continue to work in a less productive, less creative way that generates less jobs but have the coverage of health care? And I see articles now coming out of the EU bragging about how business startups are exceeding U.S. startup rates, and I'm telling you that one of the reasons that's taking place is because we've set up barriers in terms of health care coverage to those who wish to engage in this new style of activity. If, again, we wish to return the U.S. economy to being a dominant job-creating force in the world, we have to address the competitive drag that's being introduced by the health care system. I could go on, but I'll stay within my 4 minutes. I think it is critical that we address, as we go forward, health care not just for health care's sake, but health care for competitiveness and job creation's sake.